Prostate cancer affects about 1 in 8 men in America, but the good news is that it's a very treatable condition. The survival rate for men who are diagnosed with early-stage prostate cancer is more than 99%. For many men, surgery is a common form of treatment, and while it can be highly successful, there can be side effects that you didn't expect. Urinary incontinence occurs to varying degrees in virtually all men who've had their prostate removed, a procedure called a prostatectomy. Even radiation treatment can cause leakage for some men, though it's usually less severe than for those who've had surgery. What happens in a prostatectomy is that, after the prostate is taken out, the bladder is connected to the urethra, moving it down to where the prostate once was. Along the way, one of the two sphincter muscles that provides bladder control is also removed. You still have another, but that can be damaged in the process, affecting your bladder function. When you have this procedure, don't imagine that you're going to be the exception to the rule. You can almost certainly expect some leakage in the months right after. Most men regain control in a few months to a year, but for about 6 to 8% of men, the problem can persist. You might experience stress urinary incontinence, where you leak when stress is placed on your bladder or sphincter. Coughing, laughing, sneezing, or exercising are often enough to produce leaks. You can also have overflow incontinence. This happens when you can't completely empty your bladder, often caused by a blockage of the bladder due to scarring from injury. Urge incontinence, the sudden feeling that you have to urinate right now, is common as well. So what can you do to improve your chances for a speedy return to drier days? There are a number of treatment options available to you. The first thing you're going to want to do is make use of absorbent products to help manage your episodes. There are a number of great products on the market, many of which feel natural, comfortable, and are virtually unnoticeable. Next on the agenda are pelvic floor exercises. They're known as Kegels, and they can help develop your pelvic floor muscles the same way that other exercises strengthen your physique. Biofeedback can be effective too. Sensors will be placed on your body to help you identify your pelvic floor muscle activity, teaching you how to control your muscles through visual and auditory cues. Medications are available to help relax certain muscles, improving urine flow and reducing leakage. Other types of medicine can also reduce sudden urges to urinate. Finally, if nothing else works, there's even surgery to treat your symptoms after your prostatectomy. This might involve the placement of an artificial sphincter to help you better control your flow. A small pump will be placed under the skin that can be activated to close your sphincter and keep you dry. Other options include the placement of a urethral sling which will support your urethra, or the use of a bulking agent which is injected into the urethra to help it close. No matter what treatment path you follow, it pays to be patient. Remember that what you're dealing with is something that nearly all men in your situation are going through, and with time and a little effort, your chances for a leak-free life are very good indeed. For more information, visit the National Association for Continence's page on incontinence following prostate surgery,